Well, hello, it's Bruce Williams again, and today I'm happy to start a short lecture series on the selected gross pathology of North American mammals. I wouldn't consider myself a wildlife or a zoo pathologist, and there are far better and more encyclopedic lectures out there, especially through the Davis Thompson Foundation. But I'm going to present some of the images that I've come across in my career in my limited contact with these species. With marine mammals, I was very lucky as a second-year resident to work on the Valdez oil spill, where I got to work with sea otters. But this lecture won't have a lot of sea otters because most of you out there will never have the opportunity to work with them being restricted to a very small part of North America, and also you have to work for the government pretty much to work with them. As a resident and junior staff member, I was lucky to work in a department which had an extensive contract with NOAA, so I got to look at least a histology of a lot of marine mammals. If you're interested in the pathology of marine mammals, I would certainly recommend finding lectures by Judy St. Ledger, who worked for SeaWorld for so many years. I consider herself the queen of marine mammal pathology, and she does a far better job. But let's review some of the more common diseases that you will see. Of the North American marine mammals, the cetaceans and the pinnipeds are the most specialized, and probably the diseases, although there's a lot of overlap with terrestrial mammals, may be a little bit more specialized to them. But before we do that, as we always do, I want to thank all of my friends who over the years provided me great images, especially Dr. Judy St. Ledger, a good friend and supporter of Davis Thompson Foundation and my go-to person with anything marine mammal. If we can, we'll start with a fairly common disease of cetaceans, especially dolphins in captivity, but it happens in the wild. If you look closely, we'll see two lesions on the back of this animal. First, you'll see these long scratch marks or rake marks, which are generally conspecific aggression or sometimes mating behavior, and they scratch each other with the teeth. But this often leads to a break in the skin and the inoculation of cetacean pox virus. Now, pox virus in dolphins is very similar to that in other species, with the number one exception is that you don't see the tremendous proliferation of cells. They're not big raised lesions. They're generally flat, hyperpigmented lesions with a pale margin. They may hang around for a long time, including years, and if the animal migrates to warm waters, they may decrease in severity. In this particular lesion, you see an increase in melanin pigment in the basal layer of the epidermis, and you see mild proliferation of the stratum externa, a little bit different than the skin of terrestrial mammals. And inclusion bodies will be found in between in the stratum intermedium. The disease in pinnipeds is called tattoo. Now, pox viruses aren't limited to cetaceans. We also see it in our pinnipeds, including this California sea lion. You can see these clusters of proliferative and necrotizing lesions, which are very characteristic of pox and parapox lesions. In our pinnipeds, they tend to be caused by parapox viruses, although in a couple of phocid seal species, the ones without external ears, you can see true pox viral lesions. They're probably more common in young animals, especially those that are sick or stressed by other conditions. They form the much more typical pock lesion in pinnipeds than what we see in cetaceans, with the proliferation, with the raised lesions. Over time, these lesions in both species will undergo spontaneous regression, although you may have areas of residual hyperpigmentation in the cetaceans and areas of dermal fibrosis in the pinniped species. Another disease which is seen in both pinnipeds and cetaceans are morbilliviral infections, which both first burst on the scene back in the mid-1980s with large die-offs of both cetaceans, especially off the eastern coast of the U.S., and of pinnipeds in the northern and Baltic seas back in the mid-80s. And they are both well-known diseases of these species today. They are not the same virus that you see with canine morbillivirus. They are host-adapted to these various species. One of the things that you will certainly see in marine mammals with morbilliviral infections that we don't see as much in dogs or other species is the wide variety of secondary infectious diseases. In the early investigations of these diseases, and I was lucky to be working with Drs. Tom Lipscomb and Yvonne Schulman, who investigated one of the early outbreaks. The presentations was a wide variety of infectious diseases, including fungal infections and toxoplasmosis and dermatitis from ciliates and things that you would not see in the absence of immunosuppression. It was only after a good look at these animals that the morbillivirus was discovered, which was the initial agent itself causing some disease, but causing tremendous immunosuppression and all of these other infectious agents to flourish. And this is seen in marine mammals. So the lesions that are seen in marine mammal morbilliviral infections are like canine infections times 10. There are widespread lesions in many different organs. The virus itself will cause a very characteristic bronchointerstitial pneumonia, like it does in dogs, and this can also be worsened by a number of other infections, including that of lungworms or bacterial infections, which will superimpose a suppurative bronchopneumonia on top of the bronchointerstitial pneumonia we see. You see lesions in almost every single organ system. Here in the brain, there is severe demyelination as a result of the morbillivirus, but the areas of hemorrhage and necrosis that we see here are due to a concomitant aspergillus infection in this particular individual, which is not uncommon in these animals and will cause vasculitis and necrosis in multiple organs. But the demyelination that you will see in these animals is relatively phenomenal. There are also gastrointestinal signs. The animals often have diarrhea, and you can see that there's ulceration here in the oral cavity, which goes down through the GI tract. So morbillivirus is very severe and really opens these animals up to a lot of other infectious agents. As we said before, it also is a problem in phosid seals, and a number of species have had it over the years, especially in Europe and Lake Baikal. And the outward signs are very much like what you might see in a dog with a severe case of distemper, where you can see everything from respiratory, neurologic, and gastrointestinal signs. This particular animal has a severe conjunctivitis, such as you might see in a dog. Maybe early in my career, I used to say that sea lions and seals were like ocean-going dogs because of their specialized lifestyle. They're a lot more complex than that. But I would much rather do necropsy on a seal or sea lion than a cetacean because the anatomy gets a lot wackier in the dolphins and the whales. But to get back to phocine distemper, all of these, there are a wide variety and number of different types of viruses. There are certain types of distemper viruses which are associated with various species of seals. And here you can see the characteristic bronchointerstitial pneumonia. This one, there's a lot of hemorrhage here, probably. You'll also see a suppurative bronchopneumonia in these animals. One other possibility that you should consider when you see bronchointerstitial pneumonia in pinnipeds is influenza. There have been a number of outbreaks of influenza A which have targeted pinnipeds over the years. Another disease of pinnipeds that I found very interesting was first identified back in 1972 in California sea lions in San Miguel, and it was called the San Miguel sea lion virus. This is a calicivirus which causes vesicles. Calicivirus has a number of different genuses, and it is in the vesivirus category. It causes vesicles especially on the flippers, which then will ulcerate. You can also see oral lesions in affected animals. This particular virus, unlike a lot of other caliciviruses, has the ability to infect a wide range of animals, including fish and birds. And in 1972, there was an outbreak of disease in swine, which was called vesicular exanthema. And it turns out that these are very closely related, if not the same virus. And the outbreak in swine was probably a result of serving them uncooked garbage, which contained infected fish and maybe even infected marine mammals. And it resulted in a very similar vesicular disease in the swine. The natural host of this particular agent is a perch known as the opal-eye perch, which often lives in the shallow tidal pools where the California sea lions live. It's one of their favorite and readily available things for them to eat. And we'll talk about opal-eye perch later on because they are the natural host of another disease in pinnipeds. So this is San Miguel sea lion virus. Another virus, and this is actually my finger. I don't know what I was thinking about putting my finger close to the mouth of a young dolphin here, but I was at SeaWorld with Judy St. Ledger, and she needed a picture of this proliferative lesion on the tongue of this young captive dolphin. And this is papillomavirus in an Atlantic bottlenose dolphin. Papillomaviruses in cetaceans are pretty similar to what we see in a lot of other species, which is good if you're a lumper like me. They tend to cause oral or genital lesions, and we don't know that much about the progression in wild animals, obviously, but in captive animals, a number of these, which generally turn up on the tongue, have progressed to oral squamous cell carcinoma, slowly progressive, highly infiltrative. And of course, you should know by now about the connection between papillomavirus infections and development of squamous cell carcinoma. We've seen it in a wide range of species, everything from horses to ferrets, and dolphins, it seems, have them as well. Papillomaviruses are seen in a lot of species. I'm sure the pinnipeds get this. This is a picture from Dr. Melissa Miller of papillomaviral raised plaques in the mouth of a sea otter. So not a huge surprise that you would see papillomavirus in multiple species. Another very interesting viral disease of California sea lions also is one of their more common neoplasms today. Urogenital carcinomas, which affect both male and female California sea lions, are the result of a number of factors, but especially the infection by odorin herpes virus type 1. And it's thought that there are other factors at play, including genetic factors and possibly some environmental pollutants that have made this a very common problem in some areas. The virus infects the epithelium of the reproductive tract. It obviously is sexually transmitted, and the early lesions are very thin plaques within the epithelium of the penis. This is the penis of a California sea lion, obviously a fixed specimen. You can see this ulcerated plaque, and you can see rather large neoplasms within the female reproductive tract in the vagina and in the uterus proper. These particular carcinomas tend to be somewhat poorly differentiated. They often will metastasize internally to the various lymph nodes of the pelvis, resulting in obstruction of the urinary outflow, and widespread metastasis has been seen in a number of cases. So that's otorine herpes virus 1, a rhinovirus or gamma herpes virus, likely at the root of this particular condition. If we move on to some of the important bacterial diseases that you can see, one of the most important bacterial diseases, and a disease that is seen in both elephant seals and sea lions on a every few year basis. We have outbreaks in the U.S. is one of the diseases that traditionally, if you see my urinary lectures, I say is really difficult to give a really good gross description. Here we're looking at the multilobular kidney of the elephant seal, and there is a patchy interstitial nephritis. I think that the fact that this is either an elephant seal or a California sea lion, if you're in a testing situation, is probably the most important clue that I can give you, because you want to be aware that these species are affected widely with leptospirosis. Leptospirosis interrogans variant Pomona is the one that is today most commonly isolated. It is a disease that is chronic in nature because most pinnipeds get all of the water that they ingest in their diet from their foodstuffs, from the fish. They don't drink water. They live in salt water, so they're not big water drinkers. And damage to the kidney and an increased need for water can be a real problem for them. So that is something that sort of affects the pathogenesis here. And so you have a chronic tubulointerstitial disease with localization of the spirochetes following a long bacteremic phase in the kidneys, where they localize the proximal convoluted tubules and cause tubular damage, inflammation, urinary back leak, and ultimately kidney failure. Like leptospirosis in other species, it can also be a significant cause of abortion or stillbirth, or the birth of weak pups, because it does end up in many organs, crosses the placenta, and will infect the fetus. This is a great picture from back in the 1970s during one of the very early outbreaks. And it's not recorded what the species was. It might have been Icterohemorrhagica, which causes a lot of hemorrhage, and you can see that in some of these animals. But the name for this condition, because the pups would often develop hyphema, was red eye early on. So don't see this much. It's not described in the recent literature, but it is such a great old picture. that I wanted to throw that one in here. But what you normally see is this patchy tubular interstitial nephritis in affected animals. Another bacterial disease that you can see in especially cetaceans, but also in pinnipeds as well, is brucellosis. And brucellosis can be very similar to what we see in our terrestrial species, with, once again, a widespread, long-standing bacteremia, sexual transmission, abortion, and stillborn, and infection in multiple organs, especially in affected fetuses. However, in cetaceans, especially, something that we see in cetaceans, we see to a far lesser extent, are neural forms of the disease. Brucella ceti and the special anatomy of cetaceans with large vascular plexes in the base of the brain often will cause neurobrucellosis. Another thing that is thought to contribute is the preference of Brucella ceti for development within microglia. But the large vascular plexes on the base of the brain provide an area where you can often see invasion. How Brucella gets into the brain is not totally worked out. A lot of animals will have caseous exudate here in the back of the brain, in the area of the atlanto-occipital junction. You'll often have not only the lymphoplasmacytic inflammation that you would see, but a tremendous amount of demyelination in areas away from the inflammation. So neurobrucellosis caused by Brucella ceti and Brucella pinnipedalis are diseases that are a little different in cetaceans. Here's a section of lung with a large caseating granuloma from a pinniped. And Mycobacterium pinnipedia is a member of the tuberculous forms of Mycobacteria, which include Mycobacterium tuberculosis and Mycobacterium bovis, one that you don't generally hear much about, but it causes very similar lesions, caseating granulomas. Histologically, not a lot of giant cells, not a lot of mineralization. Caseating granulomas, much like what you would see with Mycobacterium bovis. It tends to be spread. We don't know the extent of it in the wild. You can see it in southern sea lions, and it is more prevalent in oterid species like sea lions, and can be spread within captive populations. So they do have their own form of tuberculosis. Another disease that you can see that belongs to the higher bacterial diseases and often seen in captive populations. I'd seen a number of cases in the late 90s, early 2000s in captive both pinnipeds and cetaceans in exhibitions where the exhibit areas and the pools would be contaminated. Is nocardiosis or Nocardia asteroides often will cause a widespread sepsis. Here we're seeing small pyogranulomas within the liver. Usually presents as a pneumonia, so you get respiratory nocardiosis, and often will go to the bones. And once nocardia or a related bacteria, actinomyces, gets into the bone, we're very familiar with actinomyces and the bone lesions that it causes in the face of cattle. And it will do the same thing. These two very similar higher bacteria will cause nasty chronic osteomyelitis as part of the generalized sepsis. And the problem with nocardia is once it gets into the pools and these exhibits, it is very difficult to get it out and to completely disinfect it because it seems to be very hardy due to mycolic acid and similar compounds in the wall. So it's difficult to eradicate from the body. It's very difficult to eradicate from the environment. And we saw over the years animals who had succeeded each other in these exhibits come down with similar infections. So Nocardia asteroides in a variety of marine mammals, especially in captive programs, can be a problem. An equal opportunity infector of a number of marine mammal species, including cetaceans, pinnipeds, and even sea otters, is Streptococcus. And when most of these streptococci are beta hemolytic, especially the pathogenic ones, and can cause either a generalized sepsis with infection of multiple organs, especially in immunosuppressed animals, or a more localized fibrinous pleuropneumonia, or as we see here, pyothorax. Two that are especially commonly isolated are Streptococcus phocae and Streptococcus ineae, which is one that is also seen in a number of fish species, and probably these are how they get is probably through the ingestion of prey by an immunosuppressed animal. Here is a severe pyothorax. When you see fibrin in any animal species, as I say over and over, even cetaceans, you want to consider Streptococcus for a minute, because they do have some very active cytotoxic exotoxins, which will cause vascular damage, much like endotoxin. And you often get a tremendous outpouring of fibrin here in the potential spaces, which would include the pleura, the peritoneum, and in this particular case, in a sea otter, fibrin deposition within the meninges, and that's another potential space. So Streptococcus infections, don't overlook them. As we move into the fungi of note, I think we couldn't have a lecture on marine mammals without talking about a fungus that is particular to the Atlantic bottlenose dolphin, and this is Lacasia loboi. It used to be called Loboa loboi, which I thought was a much better name, but now it's Lacasia loboi. And this is a very interesting fungus that causes granulomatous inflammation within the dermis, and often these sort of cauliflower, non-pigmented or hypopigmented growths, often on the face, but you can see it in other parts of the animal. They're thick. And there's only two species that get this, dolphins and man. And in man, it is restricted to certain parts of South America. So Lacasia loboi, or lobomycosis, in the dolphin. Another fungal infection, a dimorphic fungus, which is seen not uncommonly in pinnipeds and sea otters on the west coast of the United States, is coccidioidomycosis. Coccidioides immitis is a endosporulating fungus which lives in mycelial forms in dry soil, sandy areas, dusty areas, and it's a disease whose range is spreading, starting out in the San Joaquin Valley of California, and now incorporating much of the the west coast of the United States, stretching down into California, Mexico, parts of Central America. So its range is spreading. anything that disturbs the soil, even highways with traffic passing, can cause the spores of the mycelia to get into the air, and any animals are at risk. And we see more and more cases as time goes by, coccidiomycosis, and pinnipeds who live in this area, and even sea otters who live off the coast, are at risk for inhaling the spores of this fungus. In a lot of animals, it causes a latent, long-lasting, low-level pneumonia. But in some animals, as seen here in this sea otter, you can see the small granulomas in the liver. You'll often see them, granulomas also in the lungs and in various lymph nodes. So in some animals, it can result in a fatal infection. And it's probably highly underdiagnosed in these populations. As we finish up the fungi, I do want to mention one, and this is a great picture taken by Stephen Rafferty, who works up in British Columbia in the Department of Agriculture and Lands, and does a tremendous amount of work with, especially with cetaceans. And this is the intestine of a dolphin that is infected. These sort of white, thickened bands are candida, specialized type of candida that's been identified a number of times in cetaceans, and that's Candida krusei. Usually seen in animals that are immunosuppressed. This particular animal had a coexisting mesenteric torsion, and this was a great picture from a Wednesday Slide Conference case that I had recently discovered just a couple days ago. And I noticed that the gross pictures were not published along with the histo pictures, and some of the gross pictures were wonderful. So just to mention, immunosuppressed animals, if you see Candida in any animal species, you want to think about the possibility of immunosuppression. Certainly it was seen frequently in animals with concomitant morbillivirus infection. And don't forget, there are other fungi that you can see occasionally, Zygomyces species and related species. So, but if you see Candida, you want to think about other predisposing conditions, especially heavy levels of stress or other forms of immunosuppression. Moving on to the nematode parasites of these species. Parasitism, especially in marine mammals, is very, very common because they can get parasites in a number of ways, often from their prey species. If you look at fish, they're usually loaded with parasites, and a number of the species are passed on to the host. These are older pictures, and this is a problem that is seen in pinnipeds. These are heartworms, and various species of seals and sea lions can be infected by two major types of heartworms, and the disease in pinnipeds tends to pretty well mirror what we see in in dogs. So it's not that different. Sea lions can be infected with Dirofilaria immitis. In this particular case, there is also one or two other species of note that you probably should know, and those are Acanthocylonema odenhale and Spira cauda. Usually the infections with these are often incidental, and you can often find adults located in subcutaneous areas, intramuscular areas, and cavity spaces without any associated disease. Obviously, these animals had significant disease with large numbers of worms in the right ventricle, resulting in heart failure, and a large plug of worms in the caudal vena cava. So, heartworm disease in pinnipeds. These are great pictures here of a common problem in cetaceans, and these pictures were taken down at Chulalongkorn University by my friend Sakon Sawankadan Sakanwat. I always stumble over his name, but he's a phenomenal pathologist. He is a great photographer. My apologies, my friend, for mangling your name in this particular instance. I think I've done better in previous lectures. But he always takes great pictures, and there's a fantastic one of a common parasite that we see in a wide range of marine mammals, as well as some fish species. And it is a group of species called anisakids. These are large nematodes who embed their heads into the gastric wall. And you can see over time, even if you find in areas where the worm has left, you can see the impression in the gastric mucosa, which is often lined by brightly eosinophilic antigen antibody complexes, probably from the digestive juices or saliva of the worm. And these, because they embed, can cause real problems. They obviously will cause pain. They can perforate. And so anisakids, people will get them from eating raw fish, but that's never stopped me yet. And because I do love sushi, and they can cause a problem in a number of species or species who eat fish. Here is one of my favorite flukes. How many people can say that they have favorite flukes? One of my favorite flukes, and these mushroom-shaped flukes are gastric flukes which attach to the wall of the stomach of cetaceans, and their name is Braunina cordiformis. They will result in a catarrhal gastritis, as you see here, tremendous amount of mucus, but like so many stomach flukes, they don't cause real problems like rumen flukes, paramphtostomum in deer. Don't really cause any problem. I know that there is a big one of these that lives in the capybara, but for the life of me, I cannot remember its name. So, Braunina cordiformis. They look like little mushrooms growing on the gastric mucosa, but they're really just attached flukes. Acanthocephalids are really, really prominent in marine mammals. I believe this is from a sea otter, and we saw these all the time in every sea otter we posted. They're not uncommon in other marine mammals, and they're omnipresent in fish. And so if you are doing aquarium work, you are going to see these in the sea otters, and you can also see them in other pinniped species. The two big ones that you need to remember are Chironosoma and Prophylocaulus. Once again, an embedded parasite. So sometimes they may get a little too enthusiastic during their embedding, and you will see them perforate various parts of the GI tract, the stomach, the intestine, even the gallbladder. And we would not uncommonly see sea otters with these free in their abdomens. And it doesn't always result in the death of the animal. Obviously, they are a little bit host adapted and may be able to repair a small perforation. But heavy infections may result in severe ill thrift. And here's Chironosoma in far lesser numbers in the intestine of an elephant seal. Lungworms are very common infections in both otarid and phosid seals. And there are two major species that you probably should be familiar with. Paraphilaroides species, especially Paraphilaroides decorus, and Otostrongylis circumlitis. Paraphilaroides tends to have a more universal distribution, with Otostrongylis being more a circumpolar distribution. And they're common. They often will cause, especially Philaroides, will cause a subclinical bronchopneumonia, except in immunosuppressed or stressed animals, or animals with a concurrent bacterial pneumonia, where it can cause a life-threatening pneumonia, especially in young animals. Otostrongylus circumlitis also affects a variety of seal species, and in addition to the typical bronchial changes, the catarrhal bronchiolitis, the atelectasis that it causes, this one can be associated with vascular changes in the lung, including significant vasculitis, thrombosis, and arteritis. Mites. Catarrhal rhinitis, you can see nasal mites in pinnipeds and in sea otters. Both are in the superfamily Halarachne, with sea lions having orthohalarachne species. Sea otters with Halarachne species generally don't cause a tremendous amount of problems, and they're pretty common in seals as well. Now, a parasite of the upper respiratory tract, the nasal cavities of dolphins, can be a significant parasite at times. And this is Nasotrema, the trematode of the nasal cavity of dolphins. And normally it will be very happy to stay within the nasal passages. You can get them out of the blowhole or whatever. But every once in a while, these trematodes decide to go on a bit of a walkabout. And they can migrate into the tympanic cavity, which will often will cause significant problems in animals which use sonar. They've been incriminated, never proven to be the result of strandings of cetaceans. But they can also migrate from that location up into along the auditory nerve into the brain, resulting in areas of hemorrhage and infarction. You can see this one here on the brainstem along the path of the auditory nerve. And this obviously is going to cause tremendous problems for this particular animal. So they also have very interesting triangular shaped eggs, which occasionally will get into the bloodstream, causing granulomas in multiple organs, especially the liver. But it is the aberrant migration of Nasotrema that they're known for, and getting into the brain of affected animals. Tapeworm infections. Tapeworm infections of the blubber are not uncommon. These are cestodes in the species Philobothrium, delphini in various species of dolphins. You can also see them in whales as well. They don't tend to cause a whole lot of problems. So, Cysticerca. These particular sea lions are not interested in a solar eclipse or sunbathing. Unfortunately, they are showing opisthotonus, a neurologic sign which may precede seizures. This is fairly characteristic behavior among other neurologic behaviors associated with chronic domoic acid toxicity in California sea lions. Domoic acid is a excitatory neurotoxin, which is produced by diatoms, in particular blooms of these diatoms, especially in the genus Pseudonychia, if you want to remember that. This particular toxin results in neuronal depolarization, excessive glutamate release, and activation of calcium channels, which allow excessive calcium into neurons, ultimately resulting in toxicity and their disappearance. The lesion is most commonly seen in the hippocampus, which is a readily identifiable, especially for poor neuropathologists like me, part of the brain, and also in other areas, including the parohippocampal gyrus, and results in this very characteristic neurologic disease. You can have acute severe necrosis in these algal blooms, or you can have chronic low-grade intoxication, which over time will result in the atrophy of these areas of the brain, including the atrophy of the hippocampus. As you can see on the right, these animals will strand periodically, not usually associated with the algal bloom. For a number of years, we used to do the histo work for the Marine Mammal Stranding Center, and I certainly understood, but it got very frustrating when we would work with the sea lions. We'd always get them in. The hippocampus had been removed because they were sent somewhere else for testing and for domoic acid levels, and we would get the rest of the sea lion, and this was where the exciting stuff was, and we would get everything else. And but I understood the necessity for somebody to be able to measure the levels of domoic acid. We were just part of a large research group, but it didn't make it any little less frustrating for me over time. You can see lesions elsewhere in domoic acid, especially the acute toxicities. The acute toxicities have been associated with cardiomyopathy in affected animals in areas of the of necrosis of the myocardium, whether that is a unique lesion or whether it's associated with the brain-heart syndrome because of the neuronal necrosis going on in certain parts of the brain and the well-documented connection, although not in this particular condition, of relationships between necrosis in the brain and necrosis in the heart. A couple of other diseases, we just talked about cardiomyopathy associated with acute domoic acid. There are a number of marine mammal species, especially sea otters, which will develop cardiomyopathy. Here is the heart of a sea otter. It's big, it's boggy. You can see that there is significant right heart dilation. There is areas of fibrosis. Mustelids are well known for developing heart trouble, especially ferrets as well. And so it could simply be a mustelid thing because sea otters are, we don't have a lot of them in captivity. This is a disease that probably should be better known. There are also a number of cetacean species, including pilot whales and fin whales, that will develop cardiomyopathy. So something that we should know more about. Something we know a whole lot about, especially in sea otters, but any stressed marine mammal, and obviously living in captivity has its own set of stresses, is going to be gastric ulceration. And having posted 100 or more sea otters one summer, this is something that was consistent in all of the animals that spent any time in the rehab centers or that were involved in the Valdez oil spill. They all had gastric ulcers. But this is not uncommon for mustelids of any species, and I've seen it over and over in stressed mustelids. But you can see the exact same thing. This is a stomach of a pinniped, and you can see these large coalescing ulcers here. So being a captive cetacean or pinniped, this is something that you probably deal with not on a regular basis. Something we also saw very commonly was just excessive dentition, and I think that these were wild sea otters, and you would often see the teeth broken open, but you know that they do eat a lot of shellfish and would probably break teeth trying to open that. Normally they whack it on a rock, but they gnaw on it. And as time goes by, they're going to wear their teeth down. And I think that the more we see marine mammals in captivity, the more that you will see dental problems because they live a lot longer in captivity. So things like dental problems in the oterid species of pinnipeds, arthritis, things that you normally would not see in the wild species. And then trauma. Trauma is always a problem. We've looked at these before. These are rake marks. Initially were thought to probably be interactions with sharks, but probably much more commonly to be conspecific, either aggression or maybe some form of mating behavior. Tooth marks from other within the same species, often within the same pod, and some of this might be due to the mixing of pods and bringing stranger animals into coexistence, which not only will cause an increase in these particular lesions, but also transmission of infectious diseases, which in cetaceans, like morbillivirus, may be transmitted through aerosols from blowholes. I don't have a lot of pictures of Cerenian diseases or manatees, and the ones that I have are obviously tragic ones. 40% of manatee species die by traumatic incidents, often with boats, and so most of these are forensic investigations. And you can see these are mild and might even heal. These fairly mild boat propeller marks, which just go down into the subcutis, but unfortunately not all of these animals are quite so lucky, and oftentimes you will see them that will go down into the abdominal cavity or something like that. Just absolutely tragic and not something that is understandable. And then today's oceans are a trash heap. We have just done horrible things to them and to the animals that live in them. One of the things that really is devastating for marine mammal populations are nets, especially gill nets, and animals who will get caught on. This animal is obviously very lucky, and so is this, believe it or not, because these nets can be removed, these wounds can be healed, but especially cetaceans who will see fish but not the netting can ingest netting and swallow netting. And then what lecture on marine mammals today would not include the stomach of a dolphin absolutely full of plastic bags? They look like, as they float along, they look like jellyfish or things. So a wide variety of species are attracted to them, and it's just so unnecessary. And I'll leave it at that. One last disease that we will talk about that has been seen and documented over the years in a wide variety of marine mammals is gas bubble disease, and it's something that is still somewhat controversial as to how it arises in animals. Obviously, animals that strand, and if you do a lot of work with stranded cetaceans, you look at a lot of autolysis, you look at a lot of emphysema, and you always have to be very careful that what you're looking at is not post-mortem. These animals who dive to great depths have obviously, they have evolved tremendous anatomical mechanisms for preventing decompression sickness. And so it's not something that you would expect in the normal, healthy animal. These particular bubbles here are seen. These are emboli which are seen in the liver of this particular animal. Here, bubbles within blood vessels. You will see that, obviously in fish you can see gas bubble disease in supersaturated oxygenated water where the filter is left on or is turned into high and there's too much oxygen in the water. I suppose that could happen in exhibits. I'm not familiar with that. Another thing that is controversial is the development of gas bubble disease from sonar testing by the military. I don't think that has been proven, but you will obviously see papers for and against it in the literature. So I think gas bubble disease in cetaceans is something that certainly warrants a lot more documentation before we can accept any particular pathogenesis as causative. Well, that brings me to the end of this lecture. As I said before, there's certainly better lectures out there, but I've collected these images over the years, and rather than let them sit in darkness, I will bring them forward to you with my typical overgeneralization. And if you want to find out a lot more about these diseases, I do highly recommend The Pathology of Wildlife and Zoo Animals by Terry O. Makalous and St. Ledger. Not just because I am a author of it, but I think that it's an excellent resource. It gives you very short breakdowns of many of these diseases that we've talked about today, just the stuff you really need to know. Obviously, it is difficult to put everything in Wildlife and Zoo Animals in a single volume. My only complaint about this book, it's written excellently by a lot of fantastic authors. I'm not saying that because I am one, but I am in here. My only complaint, and this is what happens when you get very big books, is the paper is sort of cheap. And I noticed in my chapter and a lot of other chapters, the images didn't come out all that great. So Academic Press, when we have volume 2, I'd like to see a more expensive book with better paper. So these great illustrations in here by all these authors are much better preserved. Okay, well, that brings me to the end of this. Thank you for hanging in there. As always, thank you for everyone who's given me these images over the years. I cannot thank you enough. I wish everybody out there health, happiness, joy this holiday season. And we're going to come back with a couple more lectures on the diseases of the terrestrial mammals. I think once we get into the terrestrial mammals, they are a lot closer to our traditional domestic species. For those of you who are taking certification examinations, you will do very well. I think that reading Terry O. Makalous is going to be, for me, it'll be a very difficult thing. But you'll do very well when you realize that any wild species could get any disease. I will never say never. Don't spend a lot of time reading articles on one instance or the first report of a common disease in an exotic species. There's lots of those out there, and just realize that most of the diseases of our North American mammals parallel those of our domestic species. So it's nice to see them. It's important to know the big syndromes and the big diseases of bears and bison and some of the wild ruminants, which we're going to talk about. But realize they will get the entire spectrum of any disease we see in our domestic species. So it's fun, it's great, but unless you are planning to go into zoo and wildlife pathology, which is very noble and a wonderful way to go, for your test, I would still focus most of my energy on diseases of domestic and laboratory species. Okay, that's my little bit of advice, and I will not say it again for the rest of these lectures. So I'll see you next time.